Today, I'm pleased to welcome Adam Schechter. Adam is Chairman, President, and CEO of LabCorp, a leading global life science company headquartered in Burlington, North Carolina. With nearly 65,000 employees worldwide, LabCorp's mission is to improve health and improve lives by delivering world-class diagnostics, accelerating the availability of innovative medicine to patients, and using technology to change the way care is delivered. Since the start of the pandemic, LabCorp has been a global leader in our response to COVID. Yet beyond the immediate demands of the pandemic, there is so much to unpack and appreciate about LabCorp, including the work of their charitable foundation around health disparities. Adam, welcome to Here for Good.
Dennis, thanks for having me here today. I'm just thrilled to be here.
So Adam, what can you tell our listeners and viewers about LabCorp that would surprise them or maybe even fascinate them? I think when I think about it, what excites you about your organization's compass?
Oh, absolutely, Dennis. So first thing is I've been the CEO of LabCorp from November 2019, so it hasn't been that long. But I was on the board of directors for about 6 years before becoming CEO. So I'm going to give you a couple of things that even surprised me when I became the CEO. First of all, we do over 500 million tests per year in the United States alone. And therefore, we're moving samples all across the United States with couriers, with a fleet of planes, in so many different ways. It makes us the 5th largest mover of goods in the United States. So you think about the United States Office, FedEx, UPS, Amazon, then there's LabCorp. So it's a massive logistics company in addition to the other things that we do. Secondarily, I don't think people realize that we truly are a global company. So about 40% of our revenue comes from drug development, which is a global business. And that 40% has been involved in more than 90% of the top drugs and vaccines in the world, but also puts us in over 100 countries around the world. So we have people in more than 100 countries around the world.
Wow, that's pretty impressive. So I like to take a closer look at how people and organizations are showing up and taking care of people as well as communities around them. I understand that LabCorp launched the LabCorp Charitable Foundation last year, which helps to fund programs and address financial and health disparities, alleviate food insecurities, as you know, which is one of the things that I'm very passionate about, and also to provide tools for schools and underserved communities. Tell me a little bit about this foundation and what these actions mean to you.
Yeah, so the first thing I would say is I think every company has to make sure that they support their local communities, the country at large, and the world. And not just at a company level, but we encourage employees to do the same. So for example, at a local level, my wife, she volunteers at our local food kitchen. I volunteer at a local hospital. At a national level, I do a lot of work with the National Alliance for Hispanics. My wife does work with the things like American Heart Association. And at a global level, I do work for water.org, which is an organization trying to get clean water to places around the world where people have no access to water. I think an organization has to do the same thing. You have to think about how do we support the communities where we have people and where we do work. You have to think about how do you support the country that you're headquartered within, and you have to think about how do you support the world and the countries where you do business.
Now, is that something that the rest of the leaders in your organization embrace? Do you have difficulties getting that to cascade throughout your organization, or is it just part of the culture?
It's part of the culture. And, LabCorp's been around for 50 years, and it always has been about improving lives and improving lives in the United States early, as we were a lab that was local to the United States. But as we became a global company, it's about what can we do around the world to improve lives. And I think healthcare companies have a very special role where they are about improving lives. Like your organization has done so much to help us through COVID, through so many different ways, and help all communities. Well, we have to do the same. And I think all organizations have to do the same. And my leadership team, the management team across LabCorp, we're committed to doing what we can to help those in need. I can give you an example of COVID, for example. We launched with 4 principles in place. One was we'd build capacity as fast as we could, irrespective to cost. I didn't care what it cost. I said, just get as many tests as we can, as fast as we can. Yeah. Number 2, I didn't want anybody to worry about access to having a test if they needed a test. So we didn't charge anybody a penny, not one penny up front, and everybody had access to our tests. Number 3, we didn't prioritize anybody over anybody else. The only prioritization we did was when hospitals needed us to help get inpatients out faster or to help with their employees so that they could treat more COVID patients. We prioritized hospital inpatients ahead of everybody else. Other than that, as we received the test, we did the test.
And there are many other health systems like Virtua that benefited from that philosophy, and I think our communities benefited from it as well. I mentioned culture a moment ago. You know, I think in addition to the community outreach initiatives that you're talking about and the work through the foundation, another area of focus for LabCorp is diversity and inclusion. You know, how does LabCorp, you know, a company, as I mentioned a moment ago, with 65,000 employees across the globe, work to ensure a diverse and inclusive workforce? That has to be a unique challenge for you.
Well, first and foremost, I believe in diversity in every way, shape, and form. I just do. And everybody on a leadership team better believe in diversity and the importance of diversity. So you have to start from the top and you have to influence the culture down. At the same time, you have to provide training from down and have an influence on the way up. And you have to find ways for people to have a voice, that every employee has a voice if they want to be heard. So we have so many ways that people could communicate with us to talk about issues they may be facing. At the same time, we put in place constituency groups. And these constituency groups are global by nature, and they have the ability to impact the entire organization. So we have a constituency group for women, for young professionals, for Black employees, Hispanic employees, Asian employees, LGBTQ employees. And we're making sure that these constituency groups are broad and that they have the ear of senior management to ensure that we're hearing what the issues are and that we're doing everything we can to address those issues. So a lot of it is about action, not what you say. And it's about listening so you know what to do.
But doesn't diversity and inclusion mean something different in different parts of the world? So when you're trying to promote a diverse environment in one of your other locations outside of the U.S., is that different than how you would be approaching diversity and inclusion within the States?
It is different in different parts of the world. You have to be sensitive to the cultures of the country, but also sensitive that you are an American-based country and that you are, you know, really confident that having diversity is the right thing to do. So we're always trying to understand the local dynamics and also understand that as a global company, we have to work to change the world, not just the United States. So what I would say is that, you know, we definitely have constituency groups that are global, but they have local chapters. And the different chapter, for example, for the Women's Network in Japan, will be working on different issues than the Women's Network in China or the Women's Network in parts of Europe. So even though we have a global framework, we allow for local to work on what their issues are and are most prominent there. And I can tell you, whenever I visit a country and I do a review of the business there, I typically meet with the constituency groups to hear how things are going, to understand the issues that they're facing. And by me doing that, I believe others will do the same thing. And it just gives a voice so we can understand the issues on a global basis. But you're right, Dennis, it's not uniform and there are different issues in different parts of the world.
Yeah, you know, here at Virtua, we refer to our employees as colleagues. And so we've developed, similar to what you have, colleague communities that sort of address things on a sort of individual basis. Let's talk a little bit about leadership during the pandemic and the impact that the pandemic has had on many of your leadership decisions. Is there a particular moment, say from the last 15 months, Adam, that stands out to you as being sort of a defining moment for you or a defining moment in your career as a result of having to lead in this particular type of environment?
Well, the first thing is, I was only CEO for about 3 months before the pandemic became a significant issue. And I realized very quickly there was no playbook for a global pandemic. So a lot of it was learning on the fly and counting on the great leaders I had around me that really understood the business even better than I did. But what I would say was there was one really hard decision I made, and there was one extraordinarily proud moment. And I'll just share those with you if you'd like. In the beginning of the pandemic, our base business was down 55% versus the prior year. And some parts of the country were down even 70% versus the prior year. So not knowing how long the pandemic would last, not knowing how difficult times would be, the hardest decision was at one point we decided not to give merit increases and not to match 401ks, and we did some furloughs. That was the hardest decision, particularly because we have many couriers, phlebotomists, laboratory technicians that count on those merit increases. I mean, they need those merit increases. But then once we realized that we were going to be able to develop more tests and be able to scale better, we were able to provide people not just their merit increases and their 401k matches, but we were able to make it retroactive. So we made everybody whole, which was, it took us probably about 5-6 months to feel confident that we can do that, but then we did it and made everybody whole. So that was the toughest decision, and I feel good about where we ended up with that decision. The area where I was most proud was one point during the pandemic in July of last year. We were building capacity as fast as we could. I mean, everybody was figuring out, how do we get more machines? How do we get more reagent? How do we get more nasal swabs? I mean, sample collections, and we were building. But it wasn't fast enough because the pandemic was spreading so quickly. So we were running into a backlog issue. So I asked for volunteers to come in and help in our laboratory. We had hundreds and hundreds of volunteers. And one Saturday morning, I was in the lab and I was opening up boxes, pixel boxes, which were ways that people can send swabs to us if they collect them at their home. And to my right were two people that came from Buffalo, New York. They drove like 3 hours to be there to help in the lab that day. And to my left was somebody from our drug development business that said, I want to help in the laboratory. I'm just here to help. So just seeing how the LabCorp employees kind of just stepped up to the challenge, that they all wanted to be part of the solution, help the country and the world through the pandemic. That was one of my proudest moments, to see everybody kind of come together and do whatever it took to try to help.
You mentioned they felt they wanted to contribute to helping the world during the pandemic. I mean, not only were you in a position to lead during this crisis that impacted the entire world, you also had employees, throughout the entire world that were negatively impacted by the virus, either through family members or through friends and communities that were disproportionately impacted. Here in the United States, obviously, we've talked a lot and we've sort of focused on some of our more vulnerable populations, the African American, the Hispanic communities. But, you have resources in India. You have resources in places that are truly being hit hard by this virus, even still today. How has that been for you, trying to lead an organization through this crisis that is global in nature, and not just, to your point, about trying to provide the resources that are needed and getting the tests done, but impacting your employees worldwide?
Yeah, it was hard, and it's still hard. And every time we have an employee that gets COVID or we've lost some employees, it's just horrific when you hear those things. In the United States, I think people are feeling good because things are opening up. I mean, we're looking at what we can do in India to help our employees every single day, because India is suffering to such a large degree right now. I think every leader during this pandemic has to realize that every single person in your organization is suffering in one way, shape, or form, either because they feel isolated, because they have family members that feel isolated. The incidence of alcohol abuse and drug abuse has gone up significantly. The incidence of child abuse and domestic violence has gone up around the world. People are worried about their next paycheck and whether they're going to have a job in the future. People are at home trying to work while their kids are around them trying to remotely work. I mean, everybody is facing something right now. So as leaders, we have to be compassionate. We have to be thoughtful. We have to try to do the right things for the right reasons and help our organizations through those things. I spend a lot of time just talking to people in all parts of the organization around the world. Typically, in June, the first week, I fly to Japan every year. This is the first 2 years in a row that I haven't been to Japan in probably 15 years. Wow. But I'm doing a review with our people in Japan. I did that early this year, and I spent time with them for hours. We started at 4 in the morning because it was 4 p.m. their time, and we went to 10 a.m. here, p.m. there, and I got to meet some of the top talent there. I got to talk to people on a personal level. I've had to adapt my style very significantly. So I'm the type of leader that likes to just walk into a room if I see people there, no matter what country I'm in, and I sit down and talk. Well, now that I'm not visiting the countries, what I do is I just drop into WebExes. So I'll find out where we have teams meeting on WebEx, and unannounced, I'll just drop into a WebEx and say, I just want to see how everybody's doing, hear what's on your mind, and see, what's important to you that I can be doing differently. And I do that on WebExes around the world. So my main message is, be compassionate and realize that everybody is facing massive issues right now, and we need to help people through it.
In your industry, are you facing some of the same challenges that we are? Even in healthcare, we are still seeing a number of individuals that are hesitant about taking the vaccine. And so myself and many others are trying to do as much as we possibly can to promote the importance of taking the vaccine. Are you seeing, and even in healthcare, if you look across the country, in the healthcare field, we're still hovering anywhere from about 65 to 75% of our workforce that has been vaccinated. Are you seeing similar types of responses within your industry?
Yeah, we certainly are, Dennis. And we were involved in the development of almost all of the vaccines out there. So we actually do development of vaccines, yet we still see some people hesitancy. The first thing is I want to thank you and what you did and how public you are about vaccination, because I think it's really important. And in the African American community and other countries around the world, the Black communities face specific issues and trust issues when it comes. So I appreciate when leaders like yourself kind of step in there and really make a hard push. At the same time, I have to do the same thing, and all of us have to do the same thing. And it's remarkable to me, in the United States of America, a country where the vaccine is so broadly available, everybody could have access. Yeah. How many people still choose not to be vaccinated? And I think there's so much more education work that we have to do. But it starts with people like yourself being vocal, and then we have to go person by person, because it's a teaching moment, and it's an individual person-to-person discussion, I think, that really persuades people.
I agree, and we have to continue to do so. Now, I understand that LabCorp has partnered with the U.S. Department of Health and Human Services to raise awareness about new therapies. Can you share more about this partnership and why the antibody therapies are so important for us to beat COVID, and maybe even what the future holds in terms of the new therapies that are coming out?
Yeah, so what I would say is, from the beginning, we said we're going to do everything we can to help the country and the world through the pandemic. Even if it wasn't necessarily things that are directly related to us, if we can help, we're going to help. So when we first started to find positive samples, people would send us their samples, and we'd find somebody who was positive. In the beginning, we started to encourage them to donate plasma, because we realized early in the pandemic that people that have had COVID, if they donate their plasma, it could help those that get COVID in the future. So we did a massive campaign with many other companies to try to get people to donate their plasma to help others. Then when we found out that MABs could be helpful, and MABs, monoclonal antibodies, really are just a protein that disguises itself, looks like the virus, and helps your body build up protection against the virus. we realized that it helps if you have those, particularly early in COVID. So we decided to work with HHS and educate people. As soon as we found somebody was positive, we educated them to talk to their physician or the healthcare provider about monoclonal antibodies to see if they were a right candidate for that. And we found that we had a direct link to them because we were doing the test for them. And we wanted to try to help them get the right treatment where appropriate. And we're going to do that. As I look at the future, I'm very optimistic. Number one, the efficacy, meaning how well the vaccines work, is just remarkable. And the safety has been extraordinary.
Yeah.
The speed to which they came to market, I've never seen anything like that in my 30 years in industry. And I've been involved in vaccine development for most of those 30 years. It was just an amazing feat in science and innovation. It just gets you excited.
It is, but I think one of the things that really threw people off and created some hesitancy also was the name that was given, the warp speed. I mean, that in of itself, I think, created some anxiety with people around the very efficacy you talked about. Well, if something is coming, on board that fast, how can it be safe?
Yeah, I mean, I try to explain to people what the difference here versus the other vaccine work I did was threefold. First of all, we started building manufacturing plants before we knew if the vaccines worked. That's never happened before. Usually you study the vaccine, then you build the plant. The plant takes a year to build. People built those plants at risk, saved a year right there. The second thing is it usually takes a long time to enroll these trials because for a vaccine, if you're trying to prevent cervical cancer, for example, you got to study a lot of people to get a certain number that ever develop cervical cancer. Here, unfortunately, the virus was so widespread, we were able to enroll those trials faster than any trials I'd ever seen enrolled. And then the third thing is typically the regulatory agencies, whether it be the FDA or the people in Europe or China, they would wait until the studies were done and collected, and then they would do the review, which would take 6 to 9 months. Here, they started doing the review as the data came in. They didn't wait to the end. So those three things together, right, we were able to build plants faster, we were able to enroll trials quicker, review the data faster, had nothing to do with the safety or efficacy of the vaccine. It just had to do with us finding ways to go faster without jeopardizing efficacy, safety, and large numbers of people. I think that's the part that people miss by hearing the words, warp speed or, going so fast. And I wish we were able to explain the whole thing.
I do think that some of us have to take responsibility for that as well. To your point, people like yourself, myself, and others have to be more vocal and to share that information to help alleviate some of the anxiety that many of our communities experience.
Yeah, no, I agree with that. So I'm excited about the vaccines and the future for vaccines. Now, we might need a booster shot every year. And if that happens over time, less people tend to get vaccinated than even right now. So what you really need is a great treatment. So if I can tell you, if you get COVID, I have something that will prevent you from going to the hospital. Or if you go in the hospital, we have a product that will prevent you from dying. Well, then you're going to feel a lot more comfortable about living your daily life. And there's so many new products, whether it be antivirals that are broad acting, whether it be other mAbs, and there's a lot of things in development. So my hope is that we'll find an effective treatment to keep people from getting really sick, even if they get COVID. And if that's the case, then it ends up like the flu, where you don't want it, but if you get it, you can manage it. And to me, I'm optimistic for that reason.
And now that I don't think a lot of people realize that LabCorp is inside of Walgreens throughout the country. Ways to, again, make things more accessible to the community for all forms of diagnostic lab tests. Tell me about your partnership with Walgreens.
Yeah, no, it's been a great partnership, and we're in about 400 stores, either currently or about to open. And it's just another way to ensure that everybody has access to diagnostic testing. About 93% of Americans are within 10 miles of the ability to get a LabCorp blood draw, whether it be a physician, a hospital, a Walgreens, where we have a LabCorp in, or one of our own service centers. But I still don't think that's enough, Dennis. I think we have to do better. And We're going to work to have more accessibility in different communities, underserved communities across the country, and that's important to me. It's important to the team. We're going to do better. I want to have more at-home collection. We learned from COVID with our Pixel test that people are appreciative if they can actually collect the sample at home and then get the results. These were nasal swabs, so we're going to look at other things that you can do through saliva or nasal swabs and allow people in the comfort of their own living quarters to be able to send us samples. And then the third thing is, over time, we got to do better with technology and have even more availability for our testing.
You know, you said something there. So while COVID has been front and center for so many industries over the past year, other illnesses and health conditions didn't just go away because of the pandemic. Yeah. For an organization like LabCorp, you know, how do you manage operations and business as usual to ensure that, one, you got enough resources to address this pandemic and COVID-19 while still ensuring that there is, you know, appropriate testing and treatment for other health conditions that are still very problematic?
Yeah, so two parts to that question. One is, if you ask me the thing that keeps me up most at night, it's I worry about the world and the unintended consequences of COVID. I mentioned earlier that alcoholism, drug abuse, domestic violence have all gone up during COVID. But also, diagnoses have gone down. So in certain parts of our healthcare system, even diagnosis of cancer for a period of time was lower than it should have been. You know, less people didn't have cancer. It's the fact that they just weren't diagnosed with the cancer. And I worry that when they are diagnosed, they're going to be further along. A lot of people with diabetes that would typically find out in their normal healthcare visit didn't go for normal healthcare visits. And I'm worried that by the time they find out that they have the diabetes, that it'll progress further than it otherwise should have. So I think on a global basis, making sure people take care of their health and all aspects of the health is going to be important as we go through COVID, because we've frankly lost a year. And I that.
So Adam, correct me if I'm wrong, but did I read that roughly around 70% of all clinical diagnoses have some type of lab tests involved in it, or am I off in those numbers?
Yeah, no, it's about right. I mean, what I've seen is that diagnostic testing is about 3% of healthcare spend in the United States. In some countries, it's actually lower, and it's involved in about 90% of decision making. So, you know, what LabCorp does, I think, matters. And I think the world has a different perspective as we've gone through COVID on the importance of testing and what diagnostic testing can do to help prevent disease, diagnose disease, and ultimately treat disease. But Dennis, as you look at, you know, what I believe will be one of the biggest issues that our grandkids face is the fact that healthcare costs too much. Yeah. And it's growing too fast in every country in the world. It's 6% of GDP in China, but it's doubled in 7 years. In the US, it's 17% of GDP. I think all of us can do better to focus on prevention of disease and then ensuring when we treat disease that we treat it in the best, most efficient way from all aspects of efficiency. And I think LabCorp, with our diagnostic testing, can help prevent disease. And then hopefully with our drug development can help identify what modalities are going to work best, what treatments will work best for people with diseases. So we want to be part of the solution to healthcare costs over time. And then the other thing I would say is, even with that much spent on our GDP, there are so many places in our society, even in the richest countries in the world, where people don't get the healthcare that they need. And in my home country, the United States, it breaks my heart to see certain underserved communities not get the best healthcare, and even get healthcare that's worse than some third world country. Yeah. And we have to do better. We all have to do better.
Well, I think you and I are in unique positions to help impact that. And I think you obviously are doing your part. I know that perhaps once or twice you had difficulty sleeping at night, so you may have tuned into one of my podcasts, and that pretty much took care of that. So you know what my last question might be. Tell me, what would your 18-year-old self think about the person you are today?
I knew you were going to ask that question.
I didn't know if you fell asleep while watching one of my other episodes before you got to this question, but it's still there. So tell me what 18-year-old Adam would think about the person you are today.
The first thing they'd say is, boy, he married well. I met my wife when I was 19, and we've been together ever since. And she's been a rock, a pillar, and just my life partner, and she's just been awesome.
That's great.
The second thing is, I thought I was going to be in the Navy. I wanted to serve, and I found out I was colorblind, and therefore I wasn't able to. And then my wife would tell you she thought I was going to be a doctor because that's what I was planning, and I ended up a CEO. So I think I would look back and say I had no idea who I was going to be, where I was going to be, and how I was going to get there. But in the end, if you're passionate about what you do, if you feel like you can make a difference, I think you can be successful under all circumstances.
Well, I do think you are making a huge difference, and you're inspiring others. You do inspirational work. Was there anybody in your past or even now that sort of inspires you to do good? Because obviously you are, as an individual, as a leader, and that cascades throughout your organization. But one of the things that I like to sort of tap into what I consider ordinary people doing extraordinary things. And many times it's because someone else inspired them. What about yourself?
I've been inspired by so many people. I've had so many mentors and so much help along the way. What I would say is my driver is that I want to leave the world a better place than I found it. And, at the end, when this is all done and the CEO role is all gone, you go from, I've heard you go from who's who to who's that. I'm going to look back and I want to say I made a difference. And I want my children to look and say, you know what, he inspired us to do good for the world and to make the world a better place. So my intent is try to leave the world in a better place than I found it. And there's still a lot of work to be done, that's for sure.
Well, Adam, I truly appreciate the work that you and LabCorp are doing, not just for us here in the United States, but globally. And so I can't thank you enough for spending time with us on Here for Good, and I wish you and LabCorp all the best.
Thank you so much for having me. It's a pleasure. Hope to see you soon.
Sounds great.